Welcome you back here on Morning Live on SABC2 and SABC News Channel 404. July is Mental Illness Awareness Month. The non-profit organization Right to Care is training healthcare professionals to be able to assist the LGBTI community to deal with depression. This after research showed that lesbian, gay, bisexual, transgender and intersex people are 3 to 4 times likely to suffer from anxiety and stress. To tell us more about the issue, we joined in studio by Hove. He is the Global Fund Program Manager at Right to Care. Good morning to you and welcome to Morning Live.
Good morning, and good morning to your listeners and viewers.
Thank you very much indeed. Ian, first of all, just give us a perspective as to what Right to Care is.
So thank you for that. Right to Care is a non-profit organization where our key focus is to support initiatives around prevention, care and support for HIV and AIDS. With that, we do provide technical assistance to the National Department of Health, including private entities, and as well as the Department of Correctional Services. With the support of the Global Fund against HIV, TB and malaria, we have had programs that are looking into assisting the MSM and the LGBTI community. So essentially that's men who have sex with men, as well as lesbians, gays, bisexuals, transgender and intersex groups. What we have realized is that the level of mental illness in that particular community is 3 to 4 times more as compared to the general population.
But why is it so high? What are the issues that they have to deal with? Is it the fact that at times they've been discriminated by the society?
I think we need to acknowledge the fact that South Africa as a country has been a very progressive nation, where in 1996 the constitution adopted making discrimination against an individual based on their sexuality to be an illegal action. But despite all these positive gains, we are still faced with a situation where the LGBTI community in communities as well as into the public health space are still finding it difficult to access health services. It is quite imperative to note that in our African society, attaining mental health services is really not a priority. And it becomes even more difficult for the LGBTI community because of the discrimination that they face, because of the stigma that is attached due to their sexual preference. Mm-hmm. But over and above that, what we do as an organization and what we advocate for is that before anyone is labeled either LGBTI or before anyone is attached a label based on their sexual practice, we believe that we are all humans, and as an organization we believe that all individuals have a right to care and have a right to pride.
All right, but it looks like it's really taking a toll on these communities. I mean, they 3 to 4 times likely to suffer from anxiety and stress. It's quite a high number of them, I believe, that are exposed to this anxiety and stress.
That is very true. And according to the South African Depression and Anxiety Group, the data that we have obtained has really indicated that the stress levels experienced into this group is quite tremendously high as compared to the general population. One of the reasons which really contributes to that is the discrimination that the LGBTI community faces. There is difficulty for one to integrate into the LGBTI community, and as well as family acceptance. And that alone is really contributing to the high levels of stress, which will eventually lead to depression.
And I would want to believe the high level of hate crimes that they experience here in South Africa is also contributing.
There is a very high rates of hate crime that the LGBTI community is facing. And because of that, through the support of the Global Fund, the organization has taken initiatives to provide sensitization trainings as well as clinical competence trainings, including to the law enforcement groups as well as to the general population.
All right, so now you'll be training health professionals in 7 provinces. How are you facilitating it? How many healthcare professionals are you looking into training?
So to date, we have trained over 7,100 healthcare workers in 5 provinces, and our program is expanding into adding 2 new provinces. So with the exception of Northwest and Limpopo.
Why are those 2 not included?
And it's mainly because of funding limitation, as our funding was mainly focused into provinces where we have higher numbers of
and how
MSM.
Has the response been? Quickly, how has the response been?
The response has been exceptional, because to date we have reached out to over 100,000 MSM and LGBTI, and in those 100,000 we have actually provided HIV and counseling testing services to 60% of that group.
All right, no, that's where we're going to leave it. Ian, thank you so much for your time, and good luck with the remaining 2 provinces.
No, thank you, and thank you for giving us the time.
Thank you very much indeed. There you have it. Ian Hove, he is the Global Fund Program Manager at the Right to Know campaign, talking to us about raising awareness, or mental illness awareness rather, as July is Mental Illness Awareness Month.